General Linnington, you're recognized for 5 minutes for to begin testimony for the Wounded Warrior Project.
Thank you, Mr. Chairman. Chairman Rowe, ranking members Tester and Walsh, distinguished members of the committee, thank you for inviting Wounded Warrior Project to testify in front of your distinguished committee this morning. First, I'd like to congratulate the new chairman and ranking members on your leadership positions, and we look forward to working with you in the months and years to come. As background on our organization, Wounded Warrior Project has existed since 2003 with a vision to foster the most successful, well-adjusted generation of wounded veterans in our nation's history. We serve veterans who have been injured in both mind and body since 9/11, along with their caregivers, filling critical gaps where government programs end. Through our free programs and services, we connect warriors with each other and their communities. We serve them by providing physical health and wellness offerings, job placement services and benefits help, and we empower warriors to live life on their own terms. With a commitment to continuous improvement, Wounded Warrior has placed a great focus this year on improving efficiency and accountability. And this last month, we've served our 100,000th warrior, demonstrating that commitment in large numbers. In fact, over the past 3 months, Wounded Warriors registered more than 3,800 warriors and family members. These numbers demonstrate that the needs of this generation of veterans is indeed great and continues to grow. Although we have a number of policy priorities, we want to highlight just a few today. Our first priority is working to integrate existing government services with the network of nonprofit programs available across the country. Today, nonprofit organizations are delivering results in a variety of areas, from the initial transition from military service to physical and mental health to long-term economic success. Many of these efforts are well-funded, playing out on a large scale, and are tied together into well-performing networks. In 2016 alone, for example, Wounded Warrior dedicated more than $30 million to an intensive outpatient program addressing post-traumatic stress. By integrating efforts like this with VA offerings, we can transform the way we deliver care and support, improving outcomes for veterans. Our second priority is improving care for veterans with moderate to severe traumatic brain injury. Although in general, the VA provides excellent clinical care for this population, many of these veterans require more comprehensive non-clinical services, including intensive case management, home care, residential programming, life skills and behavioral coaching, and transportation assistance. The VA provides many of these services through the Assisted Living for Veterans with Traumatic Brain Injury pilot program, but this program is set to expire in October of this year and needs significant expansion. As you look at reauthorization, we would appreciate the opportunity to speak with you about how we and others may best partner with the VA and help meet the needs of this at-risk population. Our third priority is ending health insurance premium discrimination against the most seriously injured medical retirees. As you know, most military retirees pay very low costs for premiums, with TRICARE as low as $23 a month. In contrast, the most severely injured retirees, those who cannot work as a result of their injuries, qualify for Medicare. Upon qualification, these individuals lose their access to low-cost TRICARE plans and are required to purchase Medicare, with premiums skyrocketing from $23 a month to more than $110 a month. To give you an example, I want to talk about what happened to Ryan Cools, a Wounded Warrior Project employee who is sitting right behind me and who addressed this committee last year. Ryan was wounded in Iraq in 2005 when his vehicle struck an improvised explosive device, severing his right arm above the elbow and his left leg above the knee. Because of his injury, Ryan could not work for a period of time and became eligible for Medicare in 2007. At that point, Ryan lost his low-cost TRICARE benefits that he had earned as a military retiree. Even though he later improved to the point where he could return to work, he remained eligible for Medicare until last year. Only then, after 8.5 years of paying the higher Medicare premium that he did not want and did not need, was he finally able to transition back to the more reasonably priced TRICARE plan he preferred. Finally, I wish to thank the many members of this committee who were instrumental in temporarily authorizing the VA to provide in vitro fertilization. It means so much to the veterans who can finally start a family and move forward with their lives. This year, along with a broad coalition of veterans organizations, we will advocate for the committee to make that legislation permanent. In closing, I would like to thank the committees for your dedication and commitment to providing for veterans of all ages, and in particular for the generation of wounded service members having served since 9/11. Thank you for the opportunity to testify today, and I'm happy to answer any questions you have.
Thank you, General.
I was going to ask just one specific question. General Linnington, you brought up something that both Dr. Rowe and I pretty appalled by with this idea of the glitch between Medicare and TRICARE. Can you explain what's necessary or help us start going in the right direction of what is the fix to that?
I think allowing the veteran the choice of staying on TRICARE when they've been grievously injured would
As it stands, they do not, correct?
if they're grievously wounded, they're required to go on Medicare and pay the higher premiums. And Ryan can certainly speak to it more specifically than I can. But in Ryan's case, over the last 8 years, 8 years, he spent $10,000 out of pocket for the increased Medicare payment versus staying on the lower cost of TRICARE, which he earned and wanted to stay on.
Well, our expert's sitting right next to me on this, and I think this is one that we can tackle. If that's a fix, that should be done.
I want to ask a couple questions, and then if you just jump in as you'd like to and respond. But I'd like to ask about TAP, the transition from the military back, to the civilian side. Tell me your thoughts on that. Is it getting better? Is it working? We've got records. We've got all of these different things. And yes, sir.
Senator, real quick on TAP, having been in DOD for a while and looked at the great program that's been put in place, a lot of the challenges young veterans have, in particular when they get home, is things change. They go through a great program and as part of their post-military transition. They have a good plan, but then things change when they get home. They either decide they don't want to go to school, take advantage of the GI Bill, or they have a change in plan. It's really the ability to share information with local communities that want to help the veterans seamlessly transition in the communities is where we'd like to see some improvement. But the program is much better now, certainly, than it was 10 years ago, and we look for continued partnership in transition assistance between government programs and with what the nonprofit sector provides.
But I wanted to ask any of you all, and particularly the wounded warriors and the people with more complex medical care, if you have any comment on the VA use of opiate medication or alternative pain management strategies that we could be encouraging.
Yes, ma'am. I'll say I agree with you 100%. By the way, many of our warriors that we serve note in their alumni surveys they do every year the comorbidity aspects of the pain that they have, and the obviously the post-traumatic stress and traumatic brain injury recovery is very difficult and sometimes complicated by the number of drugs they're on. That yields weight gain, isolation. 85% of the 100,000 we serve, 85% are either overweight or obese because of the effects of pain, injury, mental health issues. So we are concerned, as you are, about how we can reduce the number of medications young veterans are on and look for alternative methods of treating some of the pain and symptoms they seek. And that's one of the things we do at Wounded Warrior Project is to provide some of those alternative therapies as a means of relieving some of their suffering.
Great. Well, my time is up, but we will be reintroducing legislation. I'd love to work with you, so thank you.